Robbins with your top health headlines. Most American adults worry that their food and water could expose them to toxic chemicals. That's according to a new survey of 5,000 adults from the Pew Charitable Trust. About 5 in 6 respondents said they'd like the government to do more to protect them. That desire crosses party lines and age ranges. The survey is part of Pew's new Safer Chemicals project. Meanwhile, another study shows forever chemicals, or PFAS, seem to be aging men in their 50s and 60s faster. The study from Chinese researchers found an association between PFAS exposure and accelerated aging in women as well, but not as much as middle-aged men. PFAS take years to break down in a person's body, but earlier research showed women appear to eliminate some faster than men due to pregnancy, breastfeeding, and menstruation. Plans for stricter PFAS guidelines in the U.S. have been rolled back or delayed. A new study from the American Heart Association warns the number of women living with cardiovascular disease could rise in the coming years. The findings are from historical trends, surveys, and census estimates. Without better prevention and early detection in the next 25 years, the association expects nearly a 4% rise in cases by 2050. Cardiovascular disease is already the leading cause of death for American women. Rising rates of diabetes, obesity, and high blood pressure are among the key causes. And on March 8th, we spring forward for daylight saving time, and that lost hour of sleep can take a real toll. Cleveland Clinic sleep experts say the week after the time change brings an increase in heart attacks, strokes, and even car crashes. Doctors recommend going into the time change well rested. So please aim for at least 7 hours of sleep and avoid caffeine and alcohol before bed. And after the switch, get morning sunlight. Matt said we're getting some to help reset your internal clock. And if sleep problems last more than a couple of months, experts say it may be time to see a specialist. And yes, there are still efforts to end the changes, and some states have, but no news yet here in Ohio. I'm Monica Robbins, and that's your Daily Dose.